newly launched clinic is set to highlight the importance of sleep and its impact on other health conditions. Doctors currently rely on global research for data on sleep, but the historic eNCA clinic wants to change that by conducting research and surveys to provide more insight into South African sleeping patterns. And for more on this, we're joined by a sleep expert, Dr. Alison Bentley. Dr. Bentley, good afternoon to you, and thank you so much for joining us. I mean, this is often a subject that is neglected and not addressed, but very important in just your general wellness and health. Talk us through this new clinic.
Well, as you mentioned, it's really important for productivity, for economic growth, that basically we wake up in the morning and we've had enough sleep and we are cheerful and happy and restored. But the evidence that we have, and again, you mentioned it's global evidence, but the evidence we have is that 25% of the adult population suffer from sleep apnea, about 10% of them suffer from insomnia, from various causes. And so we're looking at potentially a third of the population that is not sleeping well. And so it's really important for us to know that, to understand how they present. Do they present the same way as everybody else does? And what we can do to alleviate that so that they wake up having a good sleep.
So, and having relied on data from international, or rather from the US or other countries, didn't give you an accurate picture of what the problems are with regards to sleep deprivation of South Africans. So now that you're able to actually diagnose and investigate, you'd be able to bring about better solutions. But what about personalities as well that say, I simply cannot sleep, even if I have minimum sleep of say 4 hours, I can still perform at an optimal level. Dr. Bentley, what are the limits that we need, at least in terms of sleep or adequate sleep?
Yeah, sleep duration, as you mentioned. So certainly, I think everybody would tend to agree that the normal sleep is 7 to 8 hours per night. But that's actually not the normal, that's the average. So if you survey a population, the average could be 7 to 8 hours. But I mean, interestingly, a study that was done in young women in Cape Town showed that their average was more like 9 hours of sleep, whereas the global average is 7 to 8 hours. But really what we do when we manage sleep conditions is we don't manage the numbers at night, we actually manage daytime function. So we want to know that you wake up no matter how many hours of sleep you've had, and there are such a thing as naturally short sleepers who only need 4 or 5 hours of sleep a night, but that when you wake up you feel good and that you function the whole of the next day. I think it's really important to understand that it's not just about the next day's function when it comes to sleep, but that every single sleep disorder or deprivation of sleep has been linked to long-term cardiac health, long-term metabolic health, so increased risk of obesity, increased risk of diabetes, increased risk of depression, increased risk of dementia. So there's a whole lot of reasons for long-term health as to why we need to do research on sleep, on how people are sleeping right now.
All right, and now with the clinic, again, we speak about accessibility, or where people may feel that there is no need for them to be diagnosed adequately or properly for their condition, and they just go about being either dependent on medication, uppers and downers and all sorts of things that just aggravates the situation and could even lead to further health complications, Dr. Bentley.
Yeah, no, you're absolutely right. So I think the big problem we have in sleep medicine is that the symptoms of every sleep disorder are the same. And that is basically you're tired during the day, or you wake up feeling tired, or you're sleepy. I mean, sometimes you get less sleep than you need. Sometimes you get enough sleep, but the quality is poor. And often people put that down not to a sleep problem, but to something else. So they'll say, oh, it's work stress, or it's because I have young children and I'm just tired. Or something, male menopause, women menopause, something. They'll find a kind of lifestyle reason as to why they're not sleeping well, but it can be a sleep problem. So it's really important if you feel that you're not getting enough sleep at night, or that the sleep that you get is poor quality. So you may be getting 7 hours, but still falling asleep during the day. And I think it's really important, again, to say, like, what is normal sleepiness during the day? It is not normal to fall asleep in meetings. It is not normal to fall asleep watching TV in the early evening. It's not normal to fall asleep driving. So that is just not normal. And you should go and see somebody about that as to whether it is a sleep problem. If it's not, well, then you can pursue some other avenue. But if it's a sleep disorder, all of the sleep disorders are treatable, and so we can definitely improve your sleep. And you're right, if you have insomnia and what you're doing is just covering it up, because that's what happens if you use sleeping tablets, you're simply covering up the problem. Then if you stop the sleeping tablets, the problem comes back. And so you're not actually treating the problem, you're just kind of covering it up. Mm-hmm. And you're right, those medications may have long-term side effects.
All right, but also the general practices, to be in a beta state, for you to sleep without your mind being all over the place, you need to wind down towards the end of the day, or at least an hour prior, not to be on your social media gadgets, or even watching television, so that you're able to sleep naturally, not be dependent on medication.
No, I agree. I think we kind of have a society where we kind of work and then we sleep, and we've lost this concept of just having a period of rest. We're allowed to rest, and we should rest at the end of the day. So I see many patients who say they work until 11 o'clock and then they go straight to bed and they try to fall asleep. And I go, it's no wonder you can't fall asleep, because your head is still churning with what you've been doing. And whether that's watching TV or being on social media, I mean, it's interesting, social media, because you tend to go down a bit of a rabbit hole and follow, video after video, actually does keep you awake and keeps you engaged with that. Playing like solitaire on the same device, or playing something like Candy Crush, doesn't do the same thing. In fact, what it does is distract your mind from thinking particularly about sleep, and allow the sleepiness to come back. And I think most of us need some gap between when our minds are busy and when we need to fall asleep. And you're right, that's about half an hour to an hour where we just relax, read a book, for example, and just allow our minds to get into a calm state, so that the sleepiness that we naturally should feel at the end of the day, that we can actually see that. Otherwise, if our minds are busy, we don't notice that we're sleepy, and it is harder for us to fall asleep.
Yeah, and I mean, even if you're driven, because especially here in Johannesburg or in the big cities where everybody's chasing a dream, you want to do better and better in everything that you do. Sleep in itself is sometimes not an option, because you either have a proposal that you need to get put together, or there's exams, etc., that people undertake as part of self-development. But what are the conditions, Dr. Bentley, that sleep deprivation manifest, that people may not be aware of?
Well, I think the most interesting thing is, and it's a conversation I often have with students when they're getting towards exams, and they kind of go, so should I study or should I sleep? Like, what should I do to get the best performance? Well, the important thing is that if you shortchange yourself on sleep, then you are going to be less productive the next day. And what that means is that something that would have taken you 2 hours to do is now going to take you 3 hours, because you're slower, you're less innovative, you can think less laterally, your communication is poor. These are all executive functions which we know are the first things to go when you're sleep deprived. So you're actually not functioning well the next day. And in fact, if you are pushing for a deadline, for example, and you're having to work hard, what's really important is to take naps. And there's been evidence since the 1920s that if you take half an hour nap, so for example, if you study and you take half an hour nap, you remember more of that hour that you studied than if you stayed awake for that half an hour. So sleep is very important for memories. It's really important to make you alert. And so, I mean, artists, from Michelangelo used to take like half an hour nap. He never slept for 8 hours a night, supposedly. He would have an hour sleep here, an hour sleep there, an hour sleep there. And so he would keep himself refreshed. So if you are pushing for a deadline, the best thing to do is to work, a period. And then when you start to feel tired, take a sleep, even if it's for 2 hours, wake up again and have another and work a bit longer if you can. I think, again, also really important if you're searching for that productivity is to work at the right time for you. So what we would call the circadian rhythms. So I'm an owl. I can work till 2 o'clock in the morning, but don't ask me to get up at 4 and do anything at that time. So I would rather work till 2 and get up at 8. But other people are different, and they prefer to wake up at 4. and work then. So really important to know
Dr. Bentley,
yourself.
we certainly have to go, but very briefly, just the dependence on substances as well, other than sleeping tablets, be it alcohol or whatever people are using, your warning against such practice.
So the two big things that people don't use instead of sleeping tablets are cannabis and alcohol. And, you know, there's a lot of scaredness about being addicted to sleeping tablets. Well, I can tell you now that you're much more likely to get addicted to alcohol and cannabis, and they stop working very quickly. So the dose tends to go up much, much, much higher. So please, if you are battling to sleep, please take your doctor's advice rather than treat yourself.
All right, we're going to leave it there. Thank you very much, sleep expert Dr. Alison Bentley, talking to us about the new sleep clinic that will be gathering comprehensive data and information to help those with either insomnia or any other sleeping conditions or the lack thereof.